Hello, I'm Michelle Adams and I'm with Rooke Products. I'm here today to talk to you for the next 3 to 5 minutes about our BKA residual limb protector. I want to start by discussing the reasons why you might use a BKA. And the first is for fall protection. You'll notice at the distal end of our device this really nice pad. And also, we are proud to announce that 29 patients while wearing our BKA have fallen and not one of them has dehisced. And the second reason you'll want to use a BKA is for contracture control due to this rigid splint on the posterior side. And finally, like with all of our Rooke products, the natural warming that causes a vasodilatory cascade and a boost in regional perfusion. So let's talk about the product. First, it's a one size fits most. There's no left, there's no right, it's very easy to stock. However, we can provide a custom fit for each of your patients and the size of their residual limb, and we'll talk about that in detail. But let's start with the patella window. Here in the center of the device is what we call the patella window, where the patella fits. It should be centered squarely inside of this window, and the way that that's done is through the use of these spacers. Each BKA comes with 2 spacers. Most often you'll use 1 or none, but we do provide 2 just in case. And for my demonstration, I'll go ahead and use 1. Go ahead and place this in the distal end of the device, and centering the patella here, the rest of the residual limb will rest against this spacer. Pull this tab up and stretch the material across. To provide that custom fit, you'll want to trim this piece of material with the scissors that are provided with each BKA between these stitched lines to fit each residual limb. Go ahead and secure with Velcro and then with the buckle. Moving to the proximal end, it's much the same as the distal end. 2 buckles, this Velcro flap, and this piece of material that can be trimmed with the scissors that are provided. This can accommodate a thigh size as small as 19 inches all the way to 38 inches with the use of this additional extender tab that's attached by Velcro. So you can see we can accommodate a one size fits most. Remembering to trim this and then secure with the Velcro flap and the buckles. Making that secure, we'll move to the patella window. The patella, remember, is centered right here. You'll want to take this patella pad and place it gently right on top, securing on either side with the Velcro tabs. It says gentle right here as a reminder because the patella is a bony prominence and we don't want to cause any more undue pressure. So we want to place that really gently on top. So that's how the residual limb is placed in our BKA. But a couple of extra things to keep in mind. First, the waist belt. It comes with each BKA. This is especially helpful for your PT colleagues. When your patients go to PT, they can put this waist belt around their torso, securing it above the pannus. There's a tail, so it can be moved to either side depending on where the BKA is. It has a Velcro tab. You attach it to the outside of the BKA and it keeps it secure for PT. You want to make sure when it's opened and given to the patient that their name is written on the waistband so that it doesn't get thrown away or lost, and it can be used each time during PT. Also, I get questions about how do we keep the BKA clean? It has this really nice fabric and we want to try to keep it clean so we don't waste them. And that's a great question. First, we recommend using breathable chucks. I'm sure you're familiar with chucks. There's a couple of different varieties. We want to use the breathable kind, not the kind with the plastic backing. But if you cut that to size, if you dress the residual limb as normal, cutting a piece of chucks to size, placing the residual limb inside the BK, wrapping, that will give you that extra layer in case the limb is exudating, maybe there's bleeding, you want to prevent breakthrough, that will give you that extra layer of protection. Also, if you have a patient that's incontinent, you can use breathable chucks in the same way. You can cut it to size, tuck it around this posterior side, and then drape it down the back and on the sides, and that will give an extra layer against feces and urine to try to keep it clean. You also can spot clean with soapy wash rag and water. That might help as well. So let's do a recap. Reasons for BK use: fall protection, contracture control, and that natural warming that gives you a boost in perfusion. Also, it's a one size fits most. There's a custom fit, making sure to trim at the proximal end and the distal end so that it fits the width of the residual limb, using the spacers to help with the length of the residual limb. Also, the waist belt, making sure to write patient's name on it so it doesn't get lost or thrown away, and breathable chucks. They're your friend. They will help to keep your BK clean. Thank you so much for your time today. I appreciate it.